If you go to a therapist for a child with attention deficit disorder and he uses these terms, I guarantee that we'll get this kid controlled. But what I'm going to do, walk out of that office. There's no such thing as a guarantee because not every kid is the same, and you have to observe what you have made and what's going to happen over a long period of time. And there's going to be tremendous amounts of adjustments of what you're going to do to treat that individual. Is that correct?
Could not agree with you more because I know in my practice that so many of the children are on medications and they're not necessarily that improved. It's not a walk in the park. It's not like the kid goes on meds and suddenly their symptoms disappear. I have several patients that the medications are minimally effective, and they say it usually takes two or even more like three different trials to come up with the right medication and the right dosage. So
And that's a project that's going to change 2 years from now, 3 years from now, because kids' brains change, weight changes, circumstance changing, sleep pattern change. So you can't say this is an absolute, we're done with it.
well, again, insurance tends to drive this. What happens is the child initially gets evaluated by a neurologist, psychologist, child psychiatrist, perhaps. And what happens is they write the prescription, and the parent, because the doctor's fee is higher, maybe out of network, perhaps a longer distance away, harder to get an appointment, the pediatrician takes over the prescribing. And very often it just becomes an automatic renewal year after year because unless the parent goes in and advocates for their child and really explains that things are not working as well, very often the child, I often will get kids who've been on the same meds for 6 years, and I'll say to the parent, and they're having a lot of difficulties, and I'll say, well, when did these problems become difficult? And they'd say, it's really intensified over the last couple of years. And I'm kind of say, well, then why didn't you discuss that with the pediatrician? And they didn't even bring it up to the pediatrician.